You're watching The Morning Show from your local news leader.
Well, it is National Physical Therapy Month.
And some people might not know how physical therapy can improve your life, so we're making the rounds today to find out just how it can.
We're joined by Rachel Zubricky this morning, along with Jessica Wood, both physical therapists from Christie Clinic. Good morning.
Morning.
So just first of all, tell us about physical therapy. What are some of the benefits that people can get from it?
Well, physical therapy, obviously we're a profession that helps people move better. That's really kind of our goal. And so we're able to help people do what they want to do as well as the things that they need to do.
Yeah. Who ends up needing physical therapy? What types of people after injuries, that kind of stuff?
Anyone that has any kind of musculoskeletal condition, whether it be from an injury or post-operative things such as total knee replacements, rotator cuff surgeries, even people that have balance deficits. We see women's health patients. Rachel works with a lot of pediatric patients, even too, some babies, and just all sorts of patients.
So let's talk a little bit about how this can help people. We've heard so much about some of the crises that we've had here with painkillers and what that leads to, you know, a lot of heroin use and things like that. How does physical therapy impact that?
Essentially, with the guidelines of what the CDC has released back in March, is that there's way too much prescription or over prescribing of pain medicines, opioids and oxycodone and Vicodin, things along those lines. And what they want is for prescribers to come up with alternatives, and a safe alternative is physical therapy, obviously, and improving function and restoring just motion in people's lives so they can kind of get back into doing what they need to do without having to deal with the risks of what are also involved with being prescribed opioids.
Why is it important to have months like this where you can raise awareness about physical therapy and the benefits?
Well, I think a lot of times people don't realize that that's an option for them. So the American Physical Therapy Association has this month to really let people know that we're here, we're available. We've always been available, but we're really using this right now to let people know that they have choices. They can come to physical therapy. We can help them with their pain.
You guys talked about being there after an injury or after some sort of surgery. Talk a little bit about how physical therapy, can it be a preventative as well? Can it prevent you from needing surgery or prevent possibly an injury?
Absolutely. And, you know, in some cases, physical therapy may be as beneficial of a treatment as opposed to having surgery. For instance, with people with meniscus surgery, they've actually found that, you know, physical therapy is as beneficial as having a surgery in obviously recovering them and not having to go through the surgical side of the recovery aspect of things. So
yeah, always a lot of options.
Right.
Walk us through a little bit about how exactly it would work. If someone is going to physical therapy, what are some of the exercises they'll be doing, or how often do they have to go, or...
Right, and it changes person to person. You know, essentially the first day people will come and see one of the therapists, and we will evaluate them and look at functional limitations. If they have issues with their range of motion, if they're having issues with their strength, is it a postural deficit? If they have chronic low back pain, and what we do is we come up with individual treatment plans to really work on what is specifically wrong with them, and keeping in mind of what their ultimate goals are. What do they want to get back to doing, and really teach them how to recover from their injuries to get them back to where they were before.
How much of your profession is teaching people how to move in the correct way, right? Because a lot of people sometimes do exercises or, like you said, just posture, everyday things that we take for granted. Maybe our body isn't functioning in the right way.
And that's what our profession is. We are experts in movement science. So yes, we go to the gym and we can see people doing things incorrectly. And our goal is to teach people to do things correctly so that we see them a few times and they go off and do it on their own and we don't have to see them again. So we want to teach a person to be active in their own recovery.
Okay, very good. Well, Rachel, Jessica, thanks so much for joining us.
Thank you very much.
We'll be right back.